Hey everyone, Ali here. So I want to talk about something that's not so much fun, but sometimes happens, which is you have a former employee who is gone and is working somewhere else, and then they're disclosing your confidential information, which of course is super upsetting. So what do you do about that? How can you handle this? Well, there's confidential information and then there's confidential information. So real confidential information is information that's not publicly available to anyone, meaning it's truly confidential information in your practice that's unique to you and your employees. That has some protections in place. But there's other things that people sometimes consider confidential because they do it in their offices and they do it well in their offices, but it's not truly confidential, and those can be discussed and whatnot. So you have to kind of keep that in mind. The second thing is that, of course, when you're teaching people, when they're, learning about your ways and whatnot, you can't unteach it. They've learned what they've learned. But that doesn't mean that they can take your patient data or other things that you're doing well and take that and use it for someone else's benefit. So it's important to know that you do have some rights there. Now, how do you protect those rights? Well, you need to have an employment manual that talks about confidential information. You need to have a contract if it's an associate or whatnot with that also in there. If you have these things, then you're in a much better place to defend yourself if an associate or an employee leaves using your confidential information somewhere else. All right, if you ever have any questions about this or you want us to write a demand letter on your behalf, just let us know. Thanks.